Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Nasal valve when you're looking at the boundaries. So before we move, let's look at the diagram for a easier understanding. So this is the nasal valve area. And here the angle optimal, it is around 10 to 15 degrees. And this is nothing but the internal valve angle. It is an internal valve angle. Next comes the center part. The center, this is nothing but the nasal septum. Nasal septum. Next is the upper lateral cartilage. So this is nothing but the upper lateral cartilage. So below there will be a head of the inferior turbinate. So this is nothing but head of the inferior turbinate. So now let's move into theory. So laterally, what is present? So laterally it is the lower border of the upper lateral cartilage. So it is LB, the lower border of the upper lateral cartilage. And the fibrofatty tissue, the lower border of the upper lateral cartilage and the fibrofatty tissue. Fibrofatty tissue. And the anterior end of the inferior turbinate and the anterior end of the inferior turbinate. So laterally the lower border of the upper lateral cartilage and the fibrofatty tissue and the anterior end of the inferior turbinate. Now medially it includes the cartilaginous nasal septum. So medially it includes the cartilaginous nasal septum. And what is included caudally? Caudally it includes the floor. So this is the floor of the pyriform. So floor of the pyriform aperture. So medially it was the cartilaginous nasal septum and caudally it will be the floor of the pyriform aperture. The nasal valve, other important thing is the nasal valve. So this nasal valve is the narrowest part and offers maximum resistance to the airflow. So this nasal valve is nothing but it is a very narrowest part and it offers maximum resistance to the airflow. So there is maximum resistance to the airflow. To learn and grow daily like this, please do subscribe.